Afulocin. Detailed information about the medication. Afulocin is a fluoroquinolone antibiotic used to treat bacterial infections that are susceptible to the drug. It contains the active ingredient Pefloxacin and is available in tablet form. 1 Indications. Afulocin is indicated for the treatment of bacterial infections caused by organisms susceptible to Pefloxacin, including lower respiratory tract infections, pneumonia, acute exacerbations of chronic bronchitis, urinary tract infections, cystitis, urethritis, prostatitis. 1 Indications. Skin and soft tissue infections, abscesses, boils, bone and joint infections, osteomyelitis, septic arthritis, intra-abdominal infections, peritonitis, cholecystitis. Other infections, septicemia, endocarditis. 2 Contraindications. Afulocin is contraindicated in the following cases: patients with known hypersensitivity to Pefloxacin or any other component of the medication, patients with a history of seizures, patients with severe liver dysfunction, pregnant and breastfeeding women, children under 18 years of age. 3 Precautions. Renal impairment. Dose adjustment may be necessary based on renal function. Hepatic impairment. Close monitoring of liver function and possible dose adjustment may be required. Glucose 6-phosphate dehydrogenase deficiency. Use with caution as it may cause hemolytic anemia. 3 Precautions. Children during the growth period. Use with caution as it may affect bone growth. Pregnant and breastfeeding women. Avoid use due to potential harm to the fetus and infant. Patients with cardiovascular disease. Use with caution as Pefloxacin can prolong the QT interval on the electrocardiogram. 3 Precautions. Patients taking anticoagulants. Close monitoring of prothrombin time is necessary. 4 Drug interactions. Theophylline. Concomitant use with Pefloxacin can increase theophylline blood levels, leading to an increased risk of overdose. Clinical monitoring and theophylline blood level monitoring may be necessary if co-administration is required. 4 Drug interactions. Antacids containing magnesium, aluminum, or calcium may decrease the absorption of Pefloxacin from the gastrointestinal tract. These medications should be taken 4 hours before or after Afulocin. Iron and zinc salts decrease the absorption of Pefloxacin. 4 Drug interactions. Vitamin K antagonists. Close monitoring of prothrombin time is required when used with Pefloxacin. 5 Adverse effects. Afulocin can cause various adverse effects, including gastrointestinal stomach pain, nausea, vomiting, diarrhea, skin rash, itching, hives, nervous system headache, dizziness, drowsiness, sleep disturbances, restlessness, anxiety, cardiovascular tachycardia, hypotension. 5 Adverse effects. Liver. Elevated liver enzymes, kidney. Renal impairment, other photosensitivity, joint pain, tendinitis. 6 Dosage and administration. Dosage and administration of Afulocin will be determined by your doctor based on your medical condition and age. The usual dosage for adults is 400 mg, divided into 2 doses, 12 hours apart. 7 Notes. Do not exceed the prescribed dosage or take the medication for longer than instructed by your doctor. Do not stop using the medication without your doctor's consent. Take the medication with a full glass of water to avoid irritation of the gastric mucosa. 7 Notes. If you experience an allergic reaction to the medication, stop using it and inform your doctor immediately. Store the medication at room temperature, away from direct sunlight and moisture. Keep the medication out of reach of children. 8 Additional information. Consult your doctor or pharmacist before using Afulocin. Avoid self-treating based on information from websites or other sources. The medication should only be used as directed by your doctor. Disclaimer: this information is for informational purposes only and does not constitute medical advice.